Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Okay, so John, March 21st was a very special day for you and for the world, actually, because you've done something that is awesome. So tell us about what happened on March 21st.
Well, on March 21st, I got this. I don't know if you can see it.
Yes.
It says
Best day ever?
Best day ever. Let's see. I don't know.
We saw it. Yep.
You saw it?
Yeah.
And that's the shirt I have on now. Hey.
Oh.
Okay.
Okay, so I got that because Monday I gave my 100th blood donation at the NIH, and I added it up. 100 pints is 12 and a half gallons.
Wow.
So that's a little fantastic. So
Amazing.
They had a little ceremony, and I got a cake. No, wait a minute. Come back. Here we go. I got a cake. I don't know if you can see that clearly. It says, "Congratulations, John, on your 100th."
Okay.
And this is really messed up. I'm going to have to do this more technologically correct because my emails didn't go through. So maybe later on, I'll actually show you the actual photographs. They gave me a plaque. They had a little ceremony. And let's see if I can show you the little ceremony they had. Okay, and this is the doctor, the head of the transplant unit. That's not showing up very clear on my screen, but I don't know. Anyway, I'll get it together later on and show it to you. But so it was a big old plaque. And,
Big old plaque.
And it says, let's see, it says, oh.
It's hard for us to read.
Anyway, it says, Department of Transfusion Medicine recognizes John M. Buchanan Jr. for 100 donations on behalf of the countless number of clinical center patients generously supported through your blood donations. March 21st, 2022. So it's pretty emotional. Then they took me to the studio. They have a studio in the basement of Building 10 where they take all the dignitaries and everything it's like a professional photography studio. So they took some pictures. So I'm officially a member of the NIH DTM, Department of Transfusion Medicine Hall of Fame by doing 100 donations. So when you go in to donate, videos of the 100 donors come up on the screen. So I've been waiting for this for a long time. And the background behind this is definitely due to our mentor right here, Dr. Clive Callender, because the reason this all started, I attended a lecture at the Lipset Auditorium on campus of the NIH. I happened to be doing a summer fellowship there in the computer technology arena. And he talked about MOTAP. He talked about the inequity between African-American receiving donations and the African-Americans donating. So I said, well, that's not right. It was something like 65% of the recipients and only 15% of the donors. So I said, well, that doesn't sound right. So let me do something about it. But the problem was I was afraid of needles. I was literally terrified of needles. So that was a big deal for me to get over. But after 100 times, I guess I'm kind of used to it. So That's
How
it.
many people are in the
Congratulations.
How many people are in the Hall of Fame?
I asked them, and I don't know. They said it's a rare occasion, maybe one every year or every year and a half, something like that. We'll be able to get into it. But so I'm pretty proud of that.
Congratulations.
Yeah.
I remember that talk in 1996,
Wow.
26 years ago.
Wow.
It's amazing that you are so persistent and so willing to help so many others. And that's probably one of the commonest transplants of all is blood transfusion.
Yeah. Tissue donation. I didn't think of it as a transplant at first, but now I do because of your lecture. And I remember I also signed up to be a bone marrow donor, and you had a young lady there who was beautiful and said that she had been a bone marrow donor, and it hurt, but it didn't hurt too bad. She felt like somebody had punched her in the hip. That's what she said. So I said, well, doggone it, if she can do it, I can do it,
Yeah, she just called me about 6 weeks ago. I was amazed that she's still doing that kind of work and doing it well. Yeah, and I told her about you.
Oh, well,
That you're about to give your 100th donation. But anyway, we're all proud of you. Congratulations, and we can't. You're quite a hero.
thank you so much.
Yeah. Okay. You ready to start the show?
I am. Let's see. Let's go with this.
A lot of interesting articles to discuss with a variety of subjects. Some are excitingly positive and some are excitingly negative.
Go back. Hold on. Okay.
The one that all of us are will have interesting discussions about is whether daylight saving times or standard time is going to be good or bad or in between. So we'll have a lot of discussion about that article. And I don't see Darryl, but there's also an interesting article on cold showers, which he talks about. And there's a gentleman in the Washington Post who talks about how cold showers helps with depression and anxiety, and how good it was for dealing with anxiety and depression. Of course, I don't know how many people are going to buy that one, but anyway. This is the article about the man who got the first genetically modified pig heart. And he lived for 2 months and then died. Exact cause of death was not known, but several days before his death, he started deteriorating. And that's an interesting situation because the genetically modified kidney transplants were done in October. This transplant was done in January, and so the genetically modified kidneys are still functioning well, and that those patients are doing well. The difference is that with kidney transplant, you have dialysis. With heart transplant, you don't really have an option. Of course, we remember that John Robinson, our beloved member, actually had the opportunity to get on one of those machines that keeps your heart beating, but felt that that was not dignified and not the way you want to spend his life. So that for most people, if the heart transplant doesn't work, then the likelihood of death is commonest alternative. Any comments about this tremendous event, which was the first xenotransplant of the heart that we've done since way back in the 60s? Any comments or discussion about it?
I have a question.
Yeah.
My question is, they didn't just say that it was rejection for cause of death.
They didn't identify the cause of death, so we'll have to wait until they give us a report from the autopsy. So we don't know what was the cause yet.
Have they ruled out rejection?
They have not ruled out anything. But I'm sure they'll give us a full report after they've done the autopsy, but they gave us no information. But I'm sure they will.
And I would think from that report that they'll learn something and they'll continue on and get better.
Yeah, I think this is the beginning of something that's special. Since 20 people die every day because of the shortage of donors, it's something that we need to learn from and improve upon and get better and better and better. And as you said, this could be the beginning of something that's very important. Now, this is an article that talks about doctors and the top causes of death. And sometimes people think that doctors are healthier than other people, and sometimes they are, but some ways they don't do as well. This talks about and shows that white male physicians had an older mean of death than white male lawyers, white males of other professions. And same was true for Black physicians, which was it 6 years more older than lawyers and 3 years older for males of other professions. But the irony of it is that actually the training of doctors is anything but healthy. And so it is actually kind of amazing to me that the doctors live as long as we do. Because our medical school and internships and residencies associated with so little sleep and so little good health that it's amazing that we do that. But the other thing that is clear is that we have a greater risk of dying for cerebrovascular disease, accidents, and suicide, which is interesting. And suicide is the most common cause of death. I'm sorry? You had a question?
That was Dr. Atto.
What did you say?
That was Dr. Atto.
What did you say? We didn't hear.
He
Okay.
didn't realize he wasn't muted.
Oh, okay. But at that young age, you can see that suicide is the most common cause of death, age of 10 to 34, especially among physicians. And you may wonder why. I wonder why, but it's startling statistics. Also, people sometimes forget that doctors are exposed to infections and other accidents that occur while taking care of patients. But why we have so many cerebrovascular problems is a question as well.
Doc, what is hyperlipidemia?
That's where you have the cholesterol is very high. And that's usually a congenital situation, but it is associated with heart attacks and deaths, sudden deaths. Sometimes it's related to the diet. Sometimes it's related to a congenital condition, which the cholesterol level is very high.
Okay. I have another article. That was from October 2020. This one is more recent.
Yeah, and they look at, you remember the doctor who was emergency doctor who just couldn't take all of the people dying from COVID. And she took her own life. And what it points out is that doctors need help as well as anybody else. And you can see at the top, they talk about the fact that there's a stigma associated with doctors seeking mental health. And so that needs to be done away with. But that's not the case right now. And so we need more support for doctors as well as healthcare providers to take care of patients, because it's not easy getting used to losing patients. It takes a lot of understanding of the fact that we don't control life and death. But while that's true, it still is depressing when most of the patients you take care of don't survive. And so that's so people who then get depression need to be treated just like anybody else with depression, whether they're doctors or not. And that is the concern, that doctors have easier access to medications, and so if they're not being treated, they can be in a position to successfully commit suicide, which they have been doing. And certain specialties, pathology, where they work with the dead people, general surgery, oncology, where they work with cancer patients, infectious diseases, emergency medicine are the groups that have the highest suicide rates. One of the biggest problems is that they try to keep it to themselves. And if they have a therapist, they often have to report receiving treatment to licensing boards. So that is a deterrent to getting treated. And so this is one of the obstacles that needs to be removed. But it hasn't been yet, so this is a concern.
Dr. Callender, are there any required courses for doctors
Yeah,
in line with mental health?
none that I know of, really. Voluntarily you can do it, but there's no required course. Voluntarily you can, they have mental health courses that you can take, but none of them are required.
If you're just learning to be a doctor, you probably wouldn't be aware of the need so soon, maybe later on, you know, in your practice. That's when it would become critical, I would think.
And then that's why many of the people who are committing suicide are younger, for the same reason you gave.
Do you think pediatricians would have a low rate of suicide?
They would have a low rate because children don't usually die, but obstetricians, gynecologists as well, their patients don't usually die. So, but you saw the ones who have the highest rates of those who anesthesiologists also, because they have greater access to medication. You see this Provider Protection Act that creates a mental health campaign, but I haven't seen any benefit of it yet. So it's a tragic data. Any other questions about that before we go on to lights on during sleep? Is interesting that this article says that you shouldn't sleep with the lights on because it interferes with your insulin levels, and this may be a cause for high insulin resistance, which is the cause of type 2 diabetes. So they're suggesting that you should not keep the lights on when you're sleeping. Any of you sleep with the lights on?
Yeah, I do.
Some people sleep with the TV on and other things. So,
TV and lights.
yeah. Some people are afraid of the dark. And so they require light.
So, Dr. Callender, is that particular to your eyes? It doesn't affect any other part of your body?
It's probably the brain. The brain is sensitive to it. And they don't, they don't, they talk about the production of melatonin, which is, which helps you go to sleep. And they suggest that light affects the melatonin, the heart rate, and insulin. And one of the advantages of sleep, theoretically, is the heart rate goes down, and the necessity for insulin goes down as well. And they're suggesting that light alters the glucose metabolism by increasing insulin resistance.
I go feed my dog now.
So even if you have the light on, if you have a sleep mask that covers your eyes, would that be okay?
I would think so. They don't discuss that aspect of it, but that probably would. That's the equivalent of having the lights off. So.
Right.
Dr.
I
Callender,
just had my test for my A1C and I'm 5.8.
Oh, okay, that's pretty good. That's great. Yeah.
Dr. Callender, I take when I take a nap, the lights are on, and I take a nap during the day. Television might stay on and the lights might stay on, but when I go to sleep at night, I want it dark as possible.
How long are your naps?
My naps are about an hour.
Yeah, it's recommended that they should be no longer than an hour. Yeah. That's the ideal. They say people who take naps live longer than people who don't take naps.
Into midnight.
They live longer. You say they live longer?
Yes.
I think it's midnight. I take a nap.
I
But the
don't
naps-
take planned naps. I just find myself napping.
I agree. What about people who work at night and have to sleep during the day? Does that have anything to do with the?
Yeah, there was an article on that suggested that that's not healthy either, but and that people who work at night had higher death rates than those people who didn't, but they didn't go into detail on why.
Oh, okay. I did 30 years of night work.
Ah, okay. Some people are just doing better than others. Now, this is the article about
Daylight savings.
daylight saving time, and it's a tremendous debate going on now as to whether this is healthy or unhealthy. The data is pretty clear, though, that daylight saving times is associated with adverse cardiovascular events, mood disorders, and motor vehicle crashes. And the data is quite voluminous, so that the American Association of Sleep Medicine, Academy of Sleep Medicine, strongly opposes daylight saving time. And they think it should be standard time, but it should not be daylight saving time. So they're strongly opposed to it because the data says there's more heart attacks, more motor vehicle accidents, and more accidents in general. And so they think that the Senate has made a big mistake and suggesting that and approving daylight saving time. What they should have approved, they say, is that standard time
Standard time.
without change.
Mhm.
But all of the studies so far have demonstrated that this reduced sleep and the metabolic damage to the biological clock is long-term. And the evidence is voluminous. So any thoughts by you on the subject of daylight saving time versus standard time?
Doc, you know what myocyte gene expression is? Myocytes?
Yeah, that's the myocytes are the muscle cells. And the genes in the muscle. And of course, how this, when we talk about epigenetics, we mean things that in the environment that may be psychological or otherwise, that actually affect the gene. And this affects short-term and long-term, affects the genes, which result in obesity, metabolic syndrome, and other things. So that this is one of the what they would call one of the most profound epigenetic phenomena that dangerous, they say.
I feel like, personally, I feel like they need to stay with standard time. And if you think about it, we are on standard time most of the time anyway. We're only on the daylight saving time for a few months.
Any other thoughts?
My thought is that one of them makes me happy and the other one makes me mad. You know, when I have to, when I can sleep later, oh, that's cool. But when I have to wake up earlier than normal, I get mad.
Hey, I just think that how long has daylight saving times been in existence? I mean, it's almost like, okay, let's mess with this now, and then another 10 years down the road, they'll come back and reverse it. I mean, it's just another, I think, another fad, personally.
It's a long fad, and it's been studied so much that it's clear that many people die because of daylight saving time. At least that's what the data suggests.
Well, an argument, an argument for it is the people that have to drive, and they don't like to drive in the dark. So, daylight savings time, I think, sets the clock so that they have more advantage of the daylight hours during regular work hours.
And they have more accidents than anybody else because of daylight savings time.
Good morning, everyone. I have a question. Wasn't it created for the purpose of the farmers?
Yeah, workers.
Okay.
I don't know who it was created for, but I think a lot of it was related to thinking that it would be, you have longer light, and so you're better off because people who SAD, he talked about SAD, there's a seasonal affective disease that's associated with the darkness. And therefore, the goal was to have more light. And the thought was that if you have more light, you're better off. You don't have kids going to school in the dark and that kind of thing. And also, the driving force was to have a day with as much light as possible. But I don't know way back when they started it, whether farmers were the target or not. Any other comments about that? Because I think it's a topic that is going to be discussed. The concern was that the Senate approved it without a whole lot of discussion. And so in the House, there's going to be a lot of discussion about it. And it's going to be interesting to see whether the permanent problems that are associated with it will be recognized and addressed. Because the American Academy of Sleep Medicine is not objecting to changing. They just objecting to making it daylight savings time because they feel that the health risks that are associated with it are extensive. And the data is voluminous that indicates that also the motor vehicle crashes and the heart attacks and the depression.
Like a war, didn't they did something to saving time?
Say again?
Didn't they abolish it or something?
No, the Senate voted against it, but it has to go to the House, and the House will have to make a final decision.
Isn't there a state that doesn't do daylight savings time?
Yeah, there are some states
Arizona?
Yeah, I think Arizona is one of the states. So some states have taken a position already.
I wonder if they have more healthy people in Arizona because of that.
We don't know. I don't know. It's certain they don't have this problem that we have with daylight savings time, with the adverse cardiovascular events, mood disorders, and motor vehicle crashes. But that's just one state out of
51.
close to 60. So
I think they moved the thinking about the children going to school in the dark. They changed once daylight saving time was implemented. They started moving time back for the children to start school. You know,
that's one of the reasons. Yeah.
Yeah, you know, the standard time school was from 9 to 3 or whatever, you know, but then now they go to school at 7:30, 8, you know.
Yeah, and they don't get enough sleep. So
Yeah.
So it has its disadvantages and advantages. So it's gonna be interesting to see what happens in the House and whether it's turned around or not. But the medical perspective is that it's not good for your health. Now, this is another subject that has gotten a lot of discussion about whether or not intermittent fasting is good for weight loss. short term or long term.
Ooh, off-white tongue. I just need to wake up.
Sorry.
Yeah. So I don't know how many have tried this, but they talk about that many people cannot do the long-term fasting like Moses and Jesus Christ did for 40 days and 40 nights and all that. So they will not eat one day and then eat the next day. And they call that intermittent fasting. And one of the disadvantages of some say of fasting is that you fast and it's good for you, but then you put the weight back on long term. And the intermittent fasting is thought that it may accomplish some of the things that you can accomplish with profound long-term fasting. I don't know how many of you have tried intermittent fasting, but it's thought to help with being overweight, obesity, and hypertension, and of course, diabetes.
Doctor, I tried it, and where you eat for 8 hours and you fast for 16. And then, because I do all sorts of research on YouTube or whatever, and but talking to my nutritionist, and what I'm also seeing is, someone like me with liver issues, we don't need to be fasting. We need to, to nourish our body, and just eat smaller meals. I mean, I asked my nutritionist about it, and she was like, no. You just eat smaller meals and just keep your body, fed with nutrition. That's me as a liver patient.
Any other thoughts about it?
Well, I know the intermittent fasting was like you, as Kevin was talking about, you, let's say, for example, you fast for about 16 to 18 hours, let's say from 6 p.m. till 11 a.m. Then you eat from 11 a.m. to 6 p.m. And that's the intermittent fasting process. They want your body to rest. I think that's and in the morning when you get up, it's like, if you're not hungry, don't eat. And they want you to wait, as I said, a good 16 to 18 hours before you take that first meal. And then you have that window of eating a nutritional balanced meal with no junk and snacks. And then it starts all over again at 6 p.m. going back to 11 or 12 p.m. And you only have a certain window that you are able to eat. Now I've tried it. Sometimes it works. It depends on if I'm hanging out with Carol Tatum.
Oh.
Yeah, well, they don't have long-term data on it, but it's worth trying. I mean, because the one thing is clear is that the GI tract does well with not having any food in it. It makes you feel better, and it's healthy. So,
Dr. Callender, I heard the opposite. I heard when in between meals, if your stomach is empty, the digestive juices go in there and start eating your stomach. Is that true?
no.
Doctor, what about all the noise your stomach makes when you don't eat?
What about it? That just means that the intestine is moving. If you're not eating, the GI tract is still having peristalsis, which is natural. But that is when they call hunger pangs. That's what that is.
I've tried fasting one complete day a week and then eating, regularly, but not the intermittent.
Yeah, that's more like the fasting that I knew when I was growing up, and we had praying fasting. and we would fast for days,
Mhm.
yeah, or one day a week or so forth, like that.
I remember years ago, though, I did do that 40-day thing. We were having some kind of anniversary at church, and my suit was too big, and I mean too small, because I'd gained weight. And I did fast for 40 days to get into that
Wow.
suit. But,
Did you get into that
I
suit?
was much younger then.
Did you get into it?
And yeah, I got into it. Yep. But I haven't done it since then.
Dr. Deutsch?
Yes, yes. I fast for 24 days, but my fast, and I try my best to do it every 90 days, and it works wonders for my body. It is a format that I follow, and portion controls are exactly what it says, portion controls, but the result is just so amazing. The toxic release, and when it's all over, the way my body feels is just amazing. Now, I come from a generation where mothers fast 40 days. Now, I'm a branch off of that generation, but I do a fast for 24 days, and it is just fantastic. And I have found my experience with myself, my friends, and my neighbors and family members, that toxic release is so important. And so I really encourage fasting for those that can do it.
When you fast, what are you fasting from? In other words, do you drink water or not water, or do you fast from everything, or what is your fast?
Okay, there are certain foods I don't eat. I'm on a healthy diet, okay? And it's portion control, okay? For example, like a good example is fruit. I don't eat fruit after a certain time, okay? And I have
So what I'm asking is, for 24 days, do you eat anything at all?
yes,
Do you drink?
yes,
Huh?
yes, I
Oh,
do.
you do. Oh,
Yes.
do you drink anything at all?
Yes, I do.
Oh,
Yes.
okay. So it's different from the biblical fasts.
Yes, yes,
Okay.
yes.
Okay, I see.
So what types of food do you eat or drink?
Oh, you're talking to me?
Yes.
I'm sorry.
Oh, I'm sorry. I thought you were talking to the doctor. I'm just a coach, wellness coach. I have a schedule plan, and it's called like a 24-day jump start. Okay. I start off with it's a journal I have, and I start off in the morning with an energy drink to give me some nutrients in my body. Okay. Oh, let me turn this down. Sorry, I'm doing double tasking. And then I go with a probiotic, and at night I go with a cleanser. And what I do during the course of the day, I have food, but it's small portions. And I use the diabetic carb sheet, which tells you how your portions look. And it's just a schedule I go by, what I do. And it's prescript.
Okay.
I hope that answered your question.
Yes, thank you. Yes, thank you very much.
Any other thoughts about this fasting, as we have a different definition of fasting for all of these things?
Yeah, I wanted to ask about Dick Gregory. Dick Gregory tried to do the biblical fast, and it didn't work out too well.
Yeah, he did it several times.
Well, it's interesting because when people talk about fasting, it's important to understand what they mean by fast. Because some people, when they fast, they don't eat any food at all. Some people drink water. Some people don't drink water or eat anything. And so it's important that you identify when you say you're fasting, what your fasting consists of. And you have some people, for example, during Lent, they will not eat meat, they will not eat this or that or the other. So it's important when people say they're fasting to find out what they mean by that. What are they doing without? Yeah. So whenever they talk about fasting, you try to identify. But Dick Gregory and some others, often their fast would involve no food, but would involve water.
Yeah, that time I did the 40 days, I only drank water. And when I do the 1 day a week, I only drink water.
And like the Daniel fast is more like what Dr. Deutsch is talking about. And so, and those fasts don't involve not eating or drinking. It involves eating a special diet. And the Daniel fast is based upon what the Shadrach, Meshach, and Abednego did when they were taken to a different country, and they proved that you could be healthy with fasting, the Daniel fast. So.
Well, doctor, is it true that, I mean, you're going to die quicker without water than without food?
That's correct.
You know,
and that's why most fasts include water.
yeah. Okay.
And people have died fasting. So it requires an intelligent fast. And you wonder how Moses and Jesus Christ did their 40 days, 40 night fasting, but they did it, and they were the better for it. So it's an interesting topic that can be healthy. And as you have stated, once you've done those fasts, you find out how your GI tract feels so wonderful afterwards, after having a rest from some of the foods we put into our GI tracts.
Go ahead.
Excuse me. There is a book, Eating and Cooking, Getting Back to Nature by Dick Gregory, who talks extensively about fasting, and a doctor that he shared that with, and all of the reasons for the fast. As you mentioned, you start to lose a fear of poverty, a fear of many things, but you have to decide what you're fasting for. I inadvertently fasted a couple of times, once 40 days and once for 21 days. And it was actually the best thing I could have ever done for me and my body. And I was really surprised at the bulk of waste that kept coming. The only thing I craved on my fast was wine. I did do water and the second one was with smoothies, but it's real personal, and you really have to have that mindset to be able to get to a place to do that. And I believe that it can be helpful.
Yeah, well, Dr. Callender, I know that everybody has to do a partial fast when they get ready to have a colonoscopy.
Yeah, that's right. Yeah. Of course, the worst thing about the colonoscopy is the stuff they get you to drink. But the fast is not the problem. It's that horrible tasting stuff that you have to drink. Yeah.
Right.
But anyway, it's a good topic to discuss because it does have its tremendous value, positive value, and you probably never feel as good as when you have fasted. But anyway, it's as you said, it's very personal, and it kind of depends upon what you're fasting for and what your reason, and also what is your commitment.
In speaking of the water, is it is it any time that is it too much water? Can you actually drink too much water a day?
You can, but usually your body lets you know when you are overdoing it with water. But anything can be done in excess, including water.
Okay. Yeah.
Dr. Callender, is there any such thing as a bowel cleanser?
Sure. That medicine you take on the GI and the colonoscopy is a great GI cleanser. And people who have liver disease, when you lactulose is a great cleanser. Levulactulose. People who have liver disease, you have to take that. That's a great cleanser. So there are a number of cleansers.
What is that thing you just mentioned, doctor? Liver
Cleanser.
what?
Oh, levulactulose. People who have liver disease and they get into hepatic coma, they treat them with levulactulose, and that cleans out. Yeah, but if you don't have liver disease, you wouldn't know anything about it. But it is a great cleanser, and they have a number of them. And then, of course, in those old days, we used to use sorbitol and K-exolate. Those of you old-fashioned may, that sorbitol was a great cleanser as well. Yeah. Most of those cleansers are sugars of sorts, and they draw out everything with them, all the fluid in the GI tract along with them. So yes, you have diarrhea with it, but it's cleanses you. Okay, the next article you have is trying to connect COVID with the increase of diabetes. And they have noticed that the incidence of diabetes type 2 is more common after COVID. And type 1 as well as type 2, but type 2 has been more common than the type 1. And of course, this mother noted that type 1 doesn't run in the family, but it doesn't have to. As many of you know, that people who don't have history of diabetes in the family can develop type 1 diabetes with us not understanding why, but it does occur, in which your insulin producing cells are killed by a mechanism which we're not clear on. Whether it's a virus or other thing, we're not sure, but we do know that it does happen. But we have also identified type 2, which is more usually related to obesity. But so whether or not this is going to bear out over time as a causative agent of diabetes, we do know that COVID can affect the pancreas. And as such, it could kill the beta cells in the pancreas and cause type 1 or type 2 diabetes. But time will tell. This is something that is just becoming evident, and whether or not it's something that we will bear out down the line remains to be seen. Any comments, questions about that?
Dr. Callender, I just think that there's so many things that can cause diabetes, mostly type 2. You mentioned obesity, but there's so many other things that can cause type 2 diabetes, like you're saying.
Well, it's actually, I'm not really saying that obesity is causing it, certainly associated with it. And also when you lose weight, the type 2 diabetes might even disappear. That's for the type 2. For type 1, we don't really understand that because whether you lose weight or not, type 1 is different because what happens is your beta cells are dead. Okay. Whereas with type 2, you have what we call insulin resistant. So you still have beta cells that are functioning. And beta cells are the cells in the pancreas that produce insulin. So it's any comments?
Diabetes type 2 can also be caused by medication.
Yes. There's some side effects of medication, like steroids.
Yes.
Okay, now this is a this is an article which is very provocative, and what it's about is that if you have not been vaccinated, there are many transplant centers that will not allow you to get on the transplant waiting list unless you are vaccinated. And this then has forced a lot of discussion and controversy because some people think it's unethical to require people to be vaccinated before you get on the waiting list. And we've discussed this before, but the reason is that the mortality rate and the morbidity rate of those people who are not vaccinated who get transplanted is much worse if you are not vaccinated. And so the discussion is it ethical for me to say you cannot be in my transplant list unless you're vaccinated? Yeah. And that's what some transplant centers are doing. And that opens up a box of discussion that has been very controversial and almost unending. But this article talks about why, and the reason is because we already talked about the fact that the number one problem in transplantation is the shortage of donors. So you don't want to have a organ loss because of the fact that the patient was not vaccinated and they got COVID and they died from COVID. And for this reason, many centers are requiring that you have to be vaccinated in order to be on the transplant waiting list. And that's what this article is all about. And many people say it's unethical. Some people say it's unethical to do otherwise. And so that's what this article is all about.
Dr. Callender, question. They can't switch this thing around and say, well, we'll put you on the waiting list. If an organ comes up for you, then we will go ahead and vaccinate you. Can't flip it around.
No, they're not going to do that. No. And most centers will not do that. They will, because remember, it takes 2 weeks for you to be fully vaccinated. So there's no organ that's going to be around for 2 weeks. So you either have to be vaccinated or not.
Dr. Callender, this article also talks about the medical with the insurance companies, and I'm thinking they put money out for a transplant and all the expense associated with it, and then the person gets sick or passes. That's I'm thinking it's following the money has a lot to do with this also from the insurance company standpoint.
Well, actually, it has nothing to do with it. It has nothing to do with it because the transplant centers do it independent of insurance companies.
Okay.
Doctor, I mean, I would think that, because I talked to a doctor up at Hopkins about, being on a transplant list, and I had a varices that imploded at one point, and that was because I made a decision not to take the blood pressure medication because how it was making me feel, and that might have had an effect on my varices. And that doctor pretty much gave me the impression of like, if you're not going to take care of your body, we're not going to put you on the list. So I guess the science is out there saying vaccination works. If you probably smoked, they're not going to put you on the list. If you probably drink, they're not going to put you on the list. They just want to know that they're going to give this kidney liver to a patient that's going to take care of himself or herself. So I don't know if it has anything to do with ethics or not. It's just like, they're just being practical. Like, if we give you this, you got to take care of yourself.
There you go.
Any other comments or questions? Because it's an issue that is discussed, and people have taken the position that it is the right thing to do, and some think it's the wrong thing to do. So. The anti-vax people think that it's not fair to them.
Sure they do.
Okay, no other discussion of that, then this is something that people are still worried about, and that they notice in Western Europe and Israel and other places that there's this COVID surge again with Omicron subvariant. Is even more transmissible than the original one. And the question is that going to happen here as well? And so experts on the alert, they are suggesting that the booster that protects you against the Omicron will protect you against the new variant as well. But still, the data in Europe and the data in Israel make it attractive to wonder if another booster shot is necessary.
Mm.
Any comment or questions about this and whether we're going to require? It's clear that there's much data. I think there's another article that talks about who would need the booster shot. And most people think it would be the over 65 population. But there's still a lot of discussion. Time will tell, but we don't know. 69% of the United States people are fully vaccinated. So there are varying thoughts about whether or not an additional booster shot is necessary. Now, this is another article that talks about transplant recipients, because it is clear that some transplant recipients, in spite of getting a vaccination and booster shot, still about 30 to 40% still are not boosted. They don't have an antibody level that's desirable. And this article points out that with the additional booster shot, that a significant number of people have had their antibody titers increased. And so the bottom line is that it is desirable for them to get a booster shot. And this is true of the transplant recipients as well as those people who are immunocompromised for other reasons, because there are other people who are immunocompromised who are not transplant recipients. Some cancer patients and some other patients with lupus and other diseases have medications that compromise the immune system. Any comment the issue of the need for a third shot and perhaps a fourth shot for some transplant recipients? And the only way to tell is to have tests of your immune system. They look at these cells, the T cells, and the antibody titers. And what is interesting is that the protection given by the infection and the protection by the vaccine may sometimes be different. And the immunity of the infection combined with the vaccination is even better. And this looks at the number of people, although the number's not enough, but based upon the type of immunotherapy that they're given. But the problem is that you don't have enough numbers to be able to tell. But it is clear that many of the transplant patients are not responding to the vaccination in significant number, enough for them to be protected against coronavirus. And that's pretty much what this article is about. And this provoked Moderna and Pfizer to want a second booster. The only question is, who is it for? Should it be all adults over 18, or should it be only those over 65? And that is where the FDA is wrestling with this issue, and so far has not authorized it yet. And there are other discussions and there are other articles that talk about some of the other problems that are associated with requiring another booster shot.
Dr. Callender, on my lab request, is there something to check on my antibody titers?
No. No, that would require special testing. It's an interesting article because people in the White House have tested positive for the virus. And Obama tested positive. Actually, other people in the White House have tested positive.
Hillary Clinton just tested positive, didn't she?
Oh,
Hillary Clinton?
yeah, she tested positive too. Yeah, right. But she's not in the White House, though.
Well, I know that.
Yeah.
The second man tested positive, Doug Emhoff.
Right. Mm-hmm. Yep.
Yeah, that virus was left there in the White House by the former president.
Yeah.
No,
right.
no, 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 no. Sorry, that won't work. It's a different virus.
Support it.
It's a different virus. Sorry. That's not gonna work. We can drain Trump for a lot of things, not for that.
Okay.
Yeah. Now the other thing that becomes of concern is who's gonna pay for it. And we have an
Well,
audit on that too.
we can pay for all these bombs, then we can pay for it.
Well, that's what you say, but we have an article that comes up that demonstrates that they have taken that out of the budget. Common sense would agree with you, but the reality is a little different.
Will insurance companies pick it up?
Medicare and Medicare recipients so far would cover it. That's the over 65 group. But the 18 to 65, that's another question. See that statement down there? Congress failed to approve a $15.6 billion request for new pandemic funding. Now, why they would do that is, well, anyway, no comment. Just that's not wise anyway. But that's what they did. See, this is an article that talks more about the fact that we're talking about a new way without funding.
Right.
So what's going to happen? We'll see.
Be caught with the pants down again.
Yeah. Well, we shall see. We shall see. But it's going to be interesting to see what FDA rules on this.
We'll win the war in the Ukraine while people at home die of COVID illness.
Say again?
All the money's going over to Ukraine while the people at home are going to die of COVID.
Well, we shall see. It's not too late for them to reinstitute the funding that they've taken away. But we hope that you're wrong, but we shall see. One of the likely things they're going to do is make it available for those over 65. That's my thought, anyway. And because there are many reports that suggest that it's not as beneficial for those between 18 and 65. But time will tell. And it seems clear to me that we're going to need an annual booster for COVID.
Yeah.
Just like we're going to need just like we get for the flu.
Flu, sure.
At least annual.
Yeah. Especially as this article says, since we're now going maskless everywhere.
Not me.
Yeah. Yeah. Wise, you're wise.
Yeah, I looked at the hockey game the other night. I didn't see anybody with a mask on.
Yeah, that's right. I know. I went to a basketball game and about 10% had masks. All of the ushers had masks.
Anybody have any idea why this is? Republicans are skeptical of new COVID funding. What
They're
what
not
is that?
skeptical. Republicans don't want to fund anything to help people. They fund war and subsidize business, but when it comes to people and their health, then he thinks people should pull themselves up by their own bootstraps.
Well, time will tell what we will really do when push comes to shove. Because it may turn out that you're right, that they only care about other things and not about people. Well, this is a subject of great disappointment and concern. And over the next week or so, we will find out what our lawmakers are all about, as well as what our president is all about. Well, it's going to be interesting how this plays out in terms of the elections that are coming up.
That last statement about says we've learned, experience has taught us that new variants can come back with a vengeance if we aren't ready.
Yeah, that's correct. So we shall see what we shall see.
Well, you know, anyone that I work with always, my thing is keep your immune system strong.
Yes, that's the best advice. That's the best advice. And we've had articles that talk about how to keep the immune system strong. And we've had a lot of discussion today about ways in which to keep the immune system strong. Let's do the next one, which is that's something we discussed already, and we will soon. It goes right along with what the last comment you made, and we just have to wait and see. It's scary, but and we're the population that is most likely to be affected by it, 65 and over. There are many articles that suggest that the 18 to 65 is not as likely to be impacted about this new surge than will be the people over 65. But time will tell. But I think the comment that someone made earlier, that she's going to keep her mask on, makes the most sense.
Yes.
Keep your immune system ready and your mask on. That's probably the most sensible advice you can have. Okay, is this the last one, John?
Just one more.
Okay, let's go to that one.
Okay.
It's almost 10:30. Oh, yeah. Okay, yeah, this is a good one to end on. And this shows that it is spreading across the United States. However, the area is going to be spreading most as those people who are not vaccinated.
Oh, okay.
And it's thought that this is more highly transmissible. Which means that if you are not protected by vaccine and you've not had an infection before, that you're likely to be impacted by it. What happens is that those people who are vaccinated are protected for the most part against hospitalization and mortality. Doesn't mean they won't get the infection. Also, it's clear that when you get the infection, you do become infectious, as John Buchanan has said so many times. And so you then can spread it to people who have not been vaccinated. And to some who have been vaccinated can be reinfected. So what's next for us? Question is, will you have more hospitalizations and deaths? And that time will tell.
Dr. Callender, what has doubled? Is it the virus itself or the number of people that got affected?
I think it's both. The only difference is that most of the deaths and hospitalizations occur in those people who are not vaccinated, but it has doubled.
Doctor, do you know, I haven't heard the figure lately because of other things going on in the news, and but how many people are we averaging per week that are dying from COVID?
Well, this figure here tells you in March, and we're still in March, so.
Because it used to be around 2,000, wasn't it?
It says 3,000 or more.
Wow.
Yeah. So it's dropped, but it's still between 1,000 and 2,000. That's a lot.
Yes.
And it's just that most of those people are unvaccinated. So the question is, yes, they are effective. They work well in fending off severe illness, hospitalization, and death. But so being vaccinated and having been previously infected is beneficial.
Psaki, the press secretary, she got COVID for the second time.
Yeah, well, a number of people have gotten COVID for the second time, but many of them are asymptomatic. But still, they're asymptomatic, but they still are infectious. And that's the problem.
Dr. Callender, explain asymptomatic again.
Means you have the virus, but you don't have any symptoms at all.
Okay.
In other words, you feel normal, but you have a positive test. That means you can spread the virus, even though it's not affecting you.
This question here is the critical one for the world.
Well, but we know there's no question about that. Will other variants emerge? Yes.
Of course.
Yeah.
But
that's the nature of viruses.
The answer though is
yes.
All those, the reason is that all those people who are not vaccinated, who allow the virus to flourish in them and mutate, that's I think how the new variants come up, right?
Yes, sir. And that's why it's so important that we have equitable allocation of the vaccinations all over the world. And that's one of the sore spots is that there are people who do not want to be vaccinated, and there are people who do not share vaccine enough so that they can be vaccinated. And those are the elements that more likely be responsible for the emergence of the variants, as you stated.
Dr. Callender, this is the way that evolution works, isn't it?
Yeah. That's one of the ways. So it's interesting.
Pence said evolution is only a theory.
Well, most of the things that we talk about are only theories. It's interesting that when we talk about creation and the laws that are in place, who sets up those laws? And God Almighty, and these laws apply to the viruses and they apply to humans. And so it's important for us to realize who's in control.
You're talking about be fruitful and multiply?
No, I'm talking about
Survival of the fittest.
all of the above, huh? All of the above. Okay, so this is the last slide. This has been an interesting discussion of so many variations on a theme that it's very productive. We've gone from fasting to physician suicides to daylight savings time and standard time. Covered the waterfront today. So any burning questions or comments? As we've applauded Buchanan for getting into the NIH Transfusion Hall of Fame. It's been an awesome day for us, starting off with John Buchanan's entry into the Hall of Fame and talking about fasting, different types of fasting. And also recognizing the importance of continuing to mask and continue to build up your immune system and try to stay healthy as these treacherous times from the violence from without and the violence from within. Dr. Atto, you have any comments you want to make?
I have a comment.
Okay.
Okay. I noticed that right before the announcement of COVID-19, there was a surge, an emergency surge of planting trees. And I noticed that as you drive throughout the US, it was just, everyone was planting trees. And we know what the purpose of trees does for our air. And then as we got into COVID-19, I noticed that the advertisement was telling people common things. Wash your hands. Things that are just common. And I noticed that with the environment, people are throwing out more trash than ever. And when we were in the heart of the COVID-19 virus, people were doing unspeakable things when it came to trash on the streets. And to me, and you look at the trees, some of the trees now, they're covered with fungus, green fungus, and trash just sits in the streets from day after day after. So I think there's other factors and variables that are affecting the air, therefore affecting the COVID-19. That's just my belief.
Okay, any other comments before we close? Well, thank you very much for attending, and look forward to seeing you next week, and have a good weekend.
Thank you,
Thank
doctor.
you.
Thank
you.
you. Thank you.
Thank you very much.
Enjoyed it.
Thank you for all the information.
Thank you,
Be
everyone.
safe, everyone.
All
Have a
right.
good day.
Dr. Callender.
Thank you, Mr. Tatum.
You're welcome. See you next week.
All right, all right.
I will see you tomorrow.
Oh, yes, at 1 o'clock or 12.
12 o'clock.
All right, thank you. Have a nice day.
Okay, you too.
Bye-bye.
Bye.
See you now.
Carol, Sylvia talked about you.
Ah!
She said some of her fasting is because running around with you.
I said I couldn't complete all my fasting because of running around with Carol Tatum.
Same thing. Yep.
Okay, all righty. All right. You all have a blessed day.
You too.
Okay.
Well, you look real laid back.
Yep, I am.
Oh, John Tatum, we have a new visitor, Claude, finally made it.
Oh, what is he still on?
It
Yes,
looks like, hi, Claude.
How are you, John?
Good,
Hey.
good. Welcome.
Thank you. Very interesting today. Learned a lot. Matter of fact, I could only I arrived around 10:15. I'm sorry, about 10:10. Didn't catch a whole meeting, but what I did catch was very, very, very informative.
Very good. Well, come earlier next time. We start at 9. If you can get, I know people's schedules are something else, but welcome.
Thank you, John. I appreciate it.
Yep.
And everyone else.
Yep. And Elizabeth, thank you for your contribution.
And John, thank you so much for letting me know and inviting me.
Not a problem.
Okay, see you next week.